This is my 15.3 sporting injuries and treatments. First of all, we start with the head injury. And here we have two competitors playing against each other going for a header. And however, the person on the right hand side gets an elbow to their head. And therefore they fall straight to the floor with quite a lot of force and impact. Now you can see someone rushing over to them. And here she's using the thing called Dr. ABC. And here she can just see she's got rid of a football, and this is to get rid of any danger. Now she's just seeing if the player is responsive. So here she's going to be asking if she can hear him, and he can. So therefore she says, "Can you sit up slowly for me?" And she's going to check his eyesight and see if his head injury has affected his eyes. So she's just seeing how many fingers he can see when she holds them up. And he says them correctly, so it can't be that bad of a damage. But as he also is in quite a lot of pain, she says, "Okay, I'm just going to go and get some ice. Just to make sure, just get rid of any inflammatory." So she comes over, and as he seems to be rubbing both sides of his head, she's going to ask, whereabouts actually is the main pain? And he says on the right side of his head. So here she applies the ice pack, and just to make sure the ice pack is in place, she's going to wrap some tape around the side of his head, all the way around, and keep going, just to make sure it is secure. Then she'll cut it to size. And then to make sure it's even safer, she then applies some tape as well. This ice will just help in the meantime until they go to A&E or something, just to get a checkup on him. But here she's going to take him over to the sit down, just so you can relax and rest. Now I'm going to move on to a cut and a bleed. So here we're playing a basketball match between two competitors, and this boy here is about to go for a shot, and here the girl on the right hand side is obviously going to be the defender. And here he's about to go for a shot, and so she defends and jumps up in the air, but slightly misses her timing and misses the ball, and however accidentally scrapes his arm and scratches him. And here's the consequence: he is now bleeding, and he has got quite a severe cut from her nails. So therefore this assistant comes over and gets this boy to safety and puts him on the side, and then just tries to get over what's happened. So here she's using salt taps, and here she's going to see the cut and ask him how bad it hurts, and she's observing it now to see how bad it is. She's also put some gloves on just to make sure she's being very hygienic and not transferring any more bacteria. Here she's also seeing active and passive movements. This is where she's going up and down and seeing if he has much more strength or loss of strength. Also, she just touched the side of the arm just to see if any of it's tender and which part of it hurts, if it's affected the other muscle tissue as well. So now she's just wiped the side with an antiseptic wipe, just to get rid of any extra bacteria. Now she's going to apply a clean new bandage over the cut and bleeding area. Now she's going to wrap it tightly and securely, just to make sure that the area is secure and safer now. And I'm just going to tie it with a bow, and then that's fine. Now for a broken bone. Here we have another basketball match, and the girl in the pink hoodie is defending whilst this boy is shooting. And here she's going up to try and defend. However, this boy nudges her out of the way, and she goes flying out the way because all his body weight and all her body weight then fall to the floor and onto her arm, whilst the boy just carries on shooting. She has just landed funny on her arm. Here she's in a lot of pain, and here this boy is also using salt taps. So he's seeing the observation, helping her up and asking how badly it hurts. Here he's looking and also touching the area and seeing how bad it hurts, touching other areas around the forearm, just to make sure how badly it has hurt. Now he's just seeing some active and passive movements. He's trying to move it up and down and seeing whereabouts it hurts most. And he's like, "Okay, right, I think we should go and sit you down. Now stand up, and we're going to put you into a bandage and a sling." So here he has a sling, and what he's going to do, he's going to tuck the sling under her right arm and over her left shoulder. Here it's going to make a triangle shape. Then we're going to bring in the other part of the sling and put it over her right shoulder. And then he's going to tie it to the back of her neck and do this quite securely, so therefore the arm needs to be at a right angle and needs to be quite secure. And then he's just going to twist the edges and tuck it in the side just to make it neater and so everything's secure. Then he's going to take her to go and sit down on a bench. Now lastly, we have a sprain. Here we have a football game between two players, and the boy in the white and black jeans they're defending the boy, and here he does a trick and goes beside him, whereas the boy's ankle twists over where he trips over himself and his body weight goes onto his ankle. Here he's in quite a bit of pain, so someone comes over and asks him, also doing salt taps again, seeing the area, asking whereabouts it hurts and looking and also touching. And here he's getting some passive movement to see how much strength they have in their ankle. And he says, oh no, it does hurt, but he's still able to sort of walk on it a little bit, but not really because it does hurt. So here this would be a grade 1 sprain. So to deal with this, we're just going to put an ice pack on the affected area on his ankle. I'm going to do this, and then to make sure that ice stays there for a bit, then I'm going to tape the ankle up as well. So here the boy's helping by taping the ankle up and wrapping it round just to make sure that ice stays in that area. Then after this has been iced, this ice pack's been on there for quite a while, like an hour or so, then hopefully the swelling of the ankle will have gone down, and therefore you'll just tape the ankle up at the end after the ice is off. Okay, so this is my 15.3 injuries and treatments completed.